Dr. Georgia, welcome. How you doing today?
Good. How are you?
Well, I'm doing great. I'm excited because we're wrapping up the month of February, and we all know the month of February is Heart Month.
Yes.
And you're going to come in with kind of a background as a primary care doc, which you are,
Yes.
and kind of talk about the heart and how you deal with patients and their heart conditions. And the biggest thing I think we realized after talking to cardiologists, we have failed to talk about what your heart numbers mean. And that's really where the rubber meets the road in your practice, because I know I've gone to my family medicine physician. They take a sample of blood and they do a bunch of measurements and tests, and then they go over this profile with me. And, luckily I'm a physical therapist, so I understand the numbers a little bit, but a general patient may not. So let's talk about heart numbers.
Right. So usually we try to screen everyone at least over the age of 40, 45. We also offer to screen their numbers younger than that for cholesterol and diabetes, especially if there's a family history of heart disease, stroke, or diabetes. Then we offer those numbers. Were you looking for specific numbers?
Well, I want to, I'm kind of interested to talk about, because I know there's been a lot of change.
There has.
And there's been some refocus and some emphasis on this and that. But
yes.
The big thing is we hear, and we went through this period of time, maybe 15 years ago. That's how old I am, by the way. Everything was cholesterol, right?
Yes.
Everything was cholesterol. Got to watch your cholesterol. And it was all this medication, HDL, ADL, and all that stuff. What is the deal with cholesterol?
Right. Well, with cholesterol, the higher the number, the increase is your risk of heart disease, stroke, heart attack, diabetes as well. So we try to watch those numbers. You can't feel your cholesterol until you actually have an event like a stroke or a heart attack. So we try to prevent that from ever happening to you. So with the numbers, you want your total cholesterol to be less than 200. However, if you're coming to my clinic, I usually see a lot of older patients, and I don't like to do fasting labs. So I look at the ratio of the total cholesterol to the HDL, and those are the same whether you're fasting or non-fasting. And so based on that, we kind of come to an agreement or kind of talk to the patient about their goals. Have they ever been on a statin before? What are their thoughts about medication? And how motivated are they in terms of their diet and exercise?
Right. And when you talk about cholesterol and you talked about HDL and LDL, I mean, for our listeners, that is high-density lipoprotein or low-density lipoprotein.
That's
and
correct.
Lipoproteins are the fat substances that you get from food when you break down food, and those fats, I mean, just trying to kind of
Yes.
set it up here, they float through the bloodstream, and then they get caught in the lining of the arteries. Is that right?
That's right. Yes, and then they build a little wall and some plaque, and then it kind of narrows the bloodstream, and so the oxygen can't get to your heart, your kidneys, or your brain. So the HDL is actually good cholesterol. The higher that is, the better. That actually helps clean up the extra cholesterol and send it back to your liver. So the higher that is, the better.
So the good one is the HDL. Okay, what kind of things can we do as patients, or you do recommend to your patients? Because I would assume you want to get those folks on HDL, or you increase the HDL, right?
Right. Unfortunately, there haven't been any studies that show a magic pill that increases the HDL. There are some studies that show moderate intensity exercise, 150 minutes a week, can help. Genetics helps. That plays a huge role. I'm reluctant to say this, but moderate alcohol consumption can also increase the HDL.
The red wine, right? The red wine and chocolate. Here we go. Yeah.
So, but yes, so it's a matter of exercise. They used to say that the omega-3 fatty acids did that, but the studies are inconclusive for that. I wouldn't say you can't have that, but I'm not sure that they'll increase the HDL.
Good, we got it down. HDL.
Yes.
We're back with Dr. Chloe Ann Georgia. Her conversation with Shannon O'Kelly continues right after this timeout on KOMO. Dr. Chloe Ann Georgia is our first guest today. Thanks for being with us. Shannon O'Kelly continues his conversation with Dr. Georgia, talking about heart health and knowing your numbers.
Okay, Dr. Georgia, great information. You clarified for me this cholesterol, HDL. Hey, let's talk about blood pressure, because that's the silent killer, right?
Yes, it can be. A patient the other day asked me, how do I know that my blood pressure is high when I don't feel anything? And I said, well, that's kind of my job, is to try to monitor your blood pressure when you come in and see how low does it go and how high does it go.
You mentioned this. There is no real symptoms that go along with I've got high blood pressure.
Some people feel their high blood pressure in terms of sometimes they have a headache, some can even have chest pain, but most people do not feel it. A good blood pressure number, there's more than one. There's actually 4 different ones. If you're healthy, under the age of 50, we would want your blood pressure less than 140/90. So I would start there and then move from that with, what do you have any family history? Are there chronic medical conditions? What do your numbers look like, your lab numbers? And so we would go on from there.
What are the things that cause high blood pressure? What is going on if someone has high blood pressure?
So what's happening is we're getting older, or our arteries are hardening as we get older, so they become harder and less flexible. So the heart has to work harder to pump all the fluid, all the blood to the oxygen, brain and kidneys and all the organs. So that is what's happening. I think I read somewhere that over 60% of patients over the age of 65, in the U.S. at least, will have elevated blood pressure. So it does happen as we get older.
But I mean, a lot of times with exercise, you can reduce blood pressure.
Yes,
and the
absolutely.
exercise, what's the benefit of exercise and blood pressure? Because I've had patients that have been recommended to go on medication. They say, no, I want to try some exercise. They go out and they start exercising, blood pressure goes down. What's going on there?
Yes. So your heart is getting stronger. It's getting more flexible. Your heart is a muscle. And so you need to work that muscle in order to keep it happy, keep it alive, keep it moving. If you just sit and you don't exercise, you don't use your heart to its best capacity, it's just going to get stiffer and older and not as strong. So we try to. So yes, I have seen many patients who've said, if I just go out for a walk 20 minutes every day, my blood pressure comes down 10 points at the end of that walk. Why is that? And I said, well, your heart is happy.
A happy heart. That's what it's all about. Now, so let's talk about, how do you know if the heart is a muscle, which it is, and muscle needs to be challenged or it needs to be exercised to get stronger.
Right.
How do I know how much exercise to do so I strengthen my heart muscle up?
Well, you certainly don't want to exercise to the point where you either, one, might pass out or feel worsening chest pain as you're exercising. But you do want to at least try to get to 150 minutes of moderate intensity exercise per week. In some studies, they found that even just 20 minutes of brisk walking for older people with limited tolerance for exercise helps.
Good stuff. Dr. Georgia, thank you. And hey, listeners, get 150 minutes in, huh?
That's Dr. Chloe Ann Georgia, and you can find out more about her and her practice at polyclinic.com. Shannon, a lot of information about the heart there, and it is National Heart Month, but this is something to be aware of all throughout the year. Obviously, heart health is a big concern for a lot of us, especially as we get older.
Absolutely, Tom. I mean, it's not just a concern for, we talk about heart and guys, and men, but actually there's a lot of knowledge, a lot of information regarding women and heart attacks. So it's for both of us, men and women, to really appreciate what your heart can do.